San Diego 6 News in the morning.
Our next guest here is talking about something along the lines of green cosmetic surgery today. Dr. Jeffry Schafer is here with Connie, one of his patients. Good to see you.
Thank you.
Fortunately, none of what we need to talk about is over there in the teleprompter. So, what is green cosmetic surgery?
Well, for years I've been doing liposuction, and we were just actually discarding the fat into appropriately containers, and we weren't not using it unless we had to fill some type of defect. And what we've been doing lately is we've been reusing and recycling that fat, and we can put it in people's faces, in their hands, in their breasts, and in their buttocks. And so it is the world's best filler because it's from your own body.
So this would take the place then of cosmetic or artificial fillers and so forth that have been used for a while now and are very effective, but this is taking right out of your own body and using it instead of taking anything from the outside.
Exactly. They're very expensive, and you can have a reaction to them, but you're not going to react to your own body. And there's, for most of Americans, there's lots of sorts of tissue.
Sure. So let's talk to Connie a little bit about what you had done and if you're happy with what you had done.
Oh, the first thing that I can say is it was a very simple procedure. It sounds like it's involved, but you're in a twilight state. And then the recovery was very quick, and I noticed a difference immediately. It was really, well, it refreshes your skin a little bit more than I would imagine the fillers do.
So it was easy then and not a lot of downtime?
Yeah, no pain. It was, actually, I went to work the next day.
Oh, very nice. Now, part of the discussion here, stem cells keep popping up, and the term stem cells keep popping into this conversation. How does that kind of weave its way into this process?
Well, this is called cell-assisted lipotransfer. Stem cells are a big part of it. It's kind of a buzzword now, like lasers were 20 years ago. So we're actually not sure if it's only the stem cells or the other milieu of cells that we put in with the stem cells. We actually add additional stem cells and cells to the fat, and that actually makes the tissue, the fat, survive better. So it's more like adding fertilizer and potting soil. So when she has, like, her surgery was over, or her procedure, really, it wasn't really surgery, was over a year ago, and we have a great amount of that fat being retained. Whereas in the past, we never would have had that volume. Plus, we're able to freeze her fat, and should she decide, you know, that she wants a little bit more, we just took it out of the freezer and put it back in.
And where do you see the implications for this going in the future then?
Well, stem cells are huge. They're using it for regenerative medicine, for people with pulmonary problems. They're using it for people with heart problems. They're rebuilding tissue. It's a multi-potential cell which can change into a lot of things. So we're just right at the very beginning. Stem cells are huge. There's going to be a huge center at UCSD with Burnham and Salk Institute. I mean, I just came back from Boston. There was a huge conference there. I was lecturing in Orange County at a big lecture on stem cells. So it is the hottest topic going.
All right. Dr. Schafer and Connie, thank you so much for coming in and sharing with us.
Thank you.
We'll see you again.
Yes.
Always good to see you. All right. For more information, you go to san diego6.com. You just click on Hot Topics.